Good afternoon, my name is Kadra Achari. My student number is 22149366. Here is my ID card. So today I'll be discussing the case of Mrs. Teresita Manalo, as shown on the screen. Mrs. Manalo has presented with embolic stroke, which has left her to lose consciousness, suffer from slurred speech, and left side weakness. I'm going to begin this presentation by evaluating the A to E assessment, going over Teresita's vital signs and how it can advise clinical judgment accordingly. I'll also make sure to link the pathophysiology throughout this section to deepen understanding of the condition. Afterwards, I'll also state the 4 nursing interventions explaining why they're necessary in the first place when caring for a patient. To conclude, I'm going to cover the nursing considerations for IT autoplays, heparin IV infusion, and metoprolol, 50 mg BD, which are medications that are to be administered to Teresita. Before I share my assessment findings, it's beneficial to know why we conduct these assessments in the first place. An ADE assessment allows nurses to recognize and treat problems that can arise whilst caring for your patient. As shown on the screen, the ADE approach by Medicast highlights the alphabetical structure which allows the nurse to rapidly assess, then stabilize the patient. Upon assessment, Mrs. Manalo's airway is patent, although her Glasgow-Coma scale sits at 12 out of 15. American Heart Association states the risk of airway obstruction increases through impaired protective reflux and possible aspiration. Teresita's slurred speech indicates a sign of ischemic injury to the brain nerves, which impacts the motor control of the facial muscle. Moving on to breathing, Mrs. Manalo's respiratory rate is reported to be 26 breaths per minute with an SpO2 of 95%. These vital signs suggest an increased strain to accessory muscles resulting in fatigue. To avoid hypoxia and promote stabilization, the patient is administered 6 liters of oxygen therapy through a Hudson mask, which is also known as a simple mask. This oxygen device delivers oxygen through a low flow requiring a minimum of 5 liters a minute, as stated by the Neurological Emergencies in Chapter 21. The likelihood of aspiration is kept at bay if the patient is positioned in a high Fowler's position whilst being delivered oxygen therapy. As we move into circulation, we note that Teresita's heart rate sits at 132 beats per minute and her blood pressure 170 over 95. According to New South Wales Health SAGO chart, these ranges approach the yellow zone, indicating the patient is more than unwell. Mrs. Manalo, having arterial fibrillation and poor control of her breathing, Shah and Yagi emphasizes how AF can lead to thrombus formation. Due to removal and migration, this activity can restrict blood supply to the brain. Due to this blockage, Rupinder Singh states peripheral perfusion is reduced. Teresita was found to be peripherally cool and pitting edema in feet. In Chapter 8 of Alterations in Cardiovascular Function Across the Lifespan, the GCS outlines eye opening, best verbal response, and motor response, which impacts Mrs. Manalo's case. Due to her left side weakness, facial droop, and speech aphasia, her GCS is 12 out of 15. Hong mentions how these symptoms can arise from oxygen deprivation and edema, both of which are symptoms found in Teresita. It's vital to perform continuous monitoring on the patient to recognize danger. As she is a stroke patient, her susceptibility of worsening edema and hemorrhage is higher, hence why a drop of less than 2 points in GCS should mandate a response. As per assessment, Teresita is afebrile with the left-handed intravenous cannula cubital fossa. This site has no wounds and bleeding, indicating the patient has no infection. As per Lewis, it's important to keep the IVC site clean and intact, allowing for the ordered compound sodium lactate to be running at 20 mL per hour. The vein is to be kept open to support medication access and stable circulation. The American Heart Association believes it's essential for embolic stroke patients like Teresita to have high-priority nursing interventions incorporated into their care through nurses. The earlier chance of avoiding complications and assisting in recovery through ongoing observations and standards of care are essential for management. Being said that, Fluid-Hogeven mentions neurological and vital observations at an hourly rate as benchmark intervention that can be integrated during care. By checking GCS, pupil reactivity, and vital signs, you can raise concerns, if any. You are able to identify deterioration or improvement. Recommended by the American Heart Association, SpO2 levels should be maintained more than or equal to 95%. This decreases the risk of aspiration and maintains cerebral perfusion. As mentioned previously, chances of Mrs. Manalo aspirating is deemed quite high. To further eliminate the risk, high Fowler's positioning is beneficial. D. Muzio expands on this by mentioning how the 60 to 90 degree angle sitting position promotes blood flow, inhibits aspiration, and enhances ventilation. Lastly, while Mrs. Manalo's blood glucose level is within range at 5.5, it's important that this fluctuation does not occur. American Heart Association emphasizes that this can have a negative impact on her recovery. A decreased BGO exacerbates symptoms of stroke, causing edema and infarction. This will set back her neurological recovery if not monitoring on a regular basis. As for Teresida's medications, she has been ordered IV alteplase, heparin IV infusion, and metoprolol 50 mg/d. Information regarding assessment, administration, and side effects of these drugs are sourced from the MIMS, Australia 2025. IV alteplase is a thrombolytic agent. This agent is responsible for dissolving active blood clots which form as a result of an ischemic stroke. For administration, there must be evidence of a hemorrhage through the ACT scan. Additionally, Teresida's OBS make sure they are stable and within range. It's also outlined the patient should be administered this drug as early as possible within a 4.5-hour symptom onset. As Teresita is a stroke patient, the recommended dose is 0.9 milligrams. This dose should be reconstituted with sterile water and bolus for over 1 minute. As we know, Teresita is also heparin sodium, a medicine which has a moderate drug interaction with alteplase. This is something to note as you must be aware of when to administer the drug. This will be further discussed after I go through adverse effects. The adverse reactions, to mention a few, include bleeding, aphasia, seizures. While some of these reactions are uncommonly reported, it's important to monitor Teresita at all times. Moving on to our next drug, heparin IV solution. This solution is an anticoagulant. While alteplase breaks down existing blood clots, this drug prevents the formation of new ones. Before administration, it's vital to conduct a partial thromboplastin time test on Teresita. This will give us an idea of how long it takes for her blood to form a clot. The patient's normal value heparin sodium and alteplase should not be administered. This can put the patient at an uncontrollable bleeding state. Baxter heparin sodium and 0.9% sodium chloride IV infusion, like all medications, to be prepared through a cell procedure and following the dose given as per order. The dose varies as the patient's age and clinical conditions taken into consideration. This drug has side effects including GI hemorrhage, osteoporosis, and hyperkalemia. It is also important to know what to do in case overdose. So 1% of solution of protamine sulfation should be utilized at no more than 50 mg, administered over 10 minutes, and this drug will basically neutralize the side effects for heparin sodium. The last medication that I will discuss is metoprolol. This drug is beta blocker, commonly used for hypertension and heart failure. Prior to administration, you must check Teresita's vital signs, specifically the heart rate and blood pressure. Metoprolol works by decreasing your blood pressure and heart rate. If these rates are too low for Teresita before administering it, it can lead to severe heart failure and circulatory disorder. Teresita should be withheld a heart rate less than 45 beats per minute and systolic blood pressure of 100. As per order, Teresita is to take 50 mg tablets twice a day. Adverse reactions for this drug include visual impairment, dizziness, mental confusion, peripheral edema. In essence, Teresita Manalo requires consistent monitoring and prompt intervention in order to avoid further complications given her complex situation of experiencing embolic stroke. As mentioned, oxygen therapy and proper drug administration are just a few interventions that will support her recovery. Through monitoring, we're able to observe a neurological condition and needs for additional support and treatments. Thank you for listening.